Hi friends, here I'm so excited to be talking to you about egg freezing. Egg freezing can be a life-changing opportunity, but it's so important that you understand all the basics. Hey friends, welcome back. One of the top questions I get asked is, should you freeze your eggs? And I think this is a fabulous question. One thing that I hate is when people call egg freezing an insurance policy or a guarantee, because the truth is there's no guarantees. That being said, egg freezing can have so many amazing opportunities and can preserve your fertility. And here is what I always say. If you are a woman and you plan out things in your life. So maybe you're like me and I'm pretty type A, and you plan out things in your life. Are you really just going to let one of your goals, becoming a mom, fall to the side and not make a plan for that? To me, that sounds really counterproductive to my personality and to how I like to approach all of my goals. Now, becoming a mom is not a goal for everybody, and it doesn't have to be a goal for you. I'm fine with that. Some women just don't know if they want the chance to become a mom. And some people are going to go through a transition in their gender, and perhaps they want to be able to freeze their eggs so that they could use them with a potential partner in the future. And some people have cancer and they're forced with having a hard choice of freezing their eggs before they undergo chemotherapy or treatment that's going to severely diminish the number of eggs they have. So whatever your reason, if you're watching this and considering freezing your eggs, I think there's some basic facts that you need to know. Number one, egg freezing is not going to deplete your egg supply. So if we use my very favorite analogy, that inside your ovary, you have a vault, and that's where all your eggs are kept. And each month you have a group of eggs come out of the vault. All egg freezing is doing is getting 1 month's supply of eggs to all grow forward instead of letting some of them die. So what happens naturally is each egg grows inside a follicle. The brain sends out follicle stimulating hormone, or FSH. FSH stimulates one of these eggs to grow. And as that egg grows, it matures, makes estrogen, and ovulates, and then all the others die. And then next month you have a new group. All egg freezing is doing is allowing all of these eggs to grow in this month. And that is why some people do multiple cycles or rounds of egg freezing. What they're really doing is taking 1 month's group of eggs, and then another month's group of eggs, and then potentially another, to try to increase the overall odds of having a child or increase the number of children that you may be able to have. There is strength in numbers when it comes to egg freezing or IVF, and the more the merrier. That doesn't mean that it's not worth doing if your egg count is low or you have diminished ovarian reserve. In fact, it actually is highly worth doing if you're not ready to get pregnant. And that's because if you're running out of eggs, your future may look really different if you have preserved options or if you do not. And so I don't want you to compromise the size of the family that you've been dreaming of just because you had this thing happen to you that you probably had no control over, which is running out of eggs early. Every woman is limited to the number of eggs she can get. And one of the things we do in a fertility assessment is we try to understand approximately how many eggs we're going to get from you in an egg freezing cycle. This is important because one, it sets expectations appropriately. You want to understand what you're getting yourself into, and you may be trying to evaluate the return on the investment. Egg freezing is not a cheap adventure. So if you're trying to understand, is it worth it for you? Setting reasonable expectations is key. Also, it helps me understand how many cycles you may need, which is good in overall counseling, and also what protocol I'm going to pick. So let's dive into the process. First of all, there's a huge misnomer that egg freezing takes many months, or it's a long process. Really, the active phase is only 2 weeks, so it's rather fast. When I think of the protocol, what I like to think about is a combination of suppression and then stimulation. So I want to first suppress your body. Imagine that this group of eggs comes out of the vault in the ovary. The brain usually sends out FSH, but if there's no FSH because you're undergoing suppression, all of those eggs are really hungry. Think of FSH as their food. So now you have a group of eggs, FSH is their food, the eggs don't see any of it. So what happens? They don't do anything. They open up their receptors and they wait. Typically, the suppression can last anywhere from about 2 to 4 weeks, and there's a variety of different suppressive options. There is birth control pills, which are frequently used because they're cheap and easy. There's suppressive medications. There's one called Lupron, there's ovulation blockers, there's estrogens, there's all combinations that we can use. You want to have a personalized protocol for you. What's best for your body, your antral follicle count, your age. So you'll have some form of suppression that you will utilize for a couple of weeks. Although it's possible to not undergo suppression, and some clinics don't typically do it. What we find is that on average, most women will respond and have a better cohort or a consistent group of eggs if they'd undergone some type of suppression before starting the second phase or the stimulation. The stimulation is very similar in most women, high doses of FSH. That's the hallmark of stimulation. The stimulation always includes shots. So it's shots that you're giving yourself into your abdomen, into your subcutaneous tissue, a tiny needle. Don't fear the needle, even if you don't love them. You can do this, I promise. So you're gonna take nightly shots for about 12 days on average, so less than 2 weeks. During that time frame, you're going to come in and you're going to have monitoring. Now, monitoring is a combination of ultrasound and blood work. And when you do monitoring, what we're trying to do is confirm that we're getting around the reasonable number of eggs that we expect, that we're not falling way off. We're also watching them grow, trying to get a consistent cohort to grow together, and trying to determine when they're going to be mature at the right time so that we can do the trigger. Now, this is important to understand. Your cycle may get canceled. And trust me, when that happens, it's terrible. Nobody wants to have your cycle canceled, myself included. But the point of a cycle cancellation is that we are not seeing what we need to see in order to get the optimal results. The two most common places for cycle cancellation, one is at baseline. So after you've undergone suppression, but before you start stimulation, we see you for a baseline exam. At the baseline exam, we are looking to make sure that the suppression worked, that your ovaries are quiet, that there's no follicles or eggs growing, and that everything is small and ready to stimulate. If, however, you have a follicle growing, your stimulation is not going to be effective in getting multiple eggs to grow, and you will find out that your cycle has been canceled or transitioned into another protocol. The other place is that throughout the course of the stimulation, if you are having markedly fewer eggs than expected, your cycle may get canceled for a different protocol in a different month. And that is because, again, strength in numbers. If we're not seeing what we want, it may not be worth it for you to proceed. Monitoring happens every 2 to 3 days. I'm being super OCD, changing your dose, harboring over every little detail, making sure we're trying to optimize that cycle as much as possible. When we get that group of eggs as mature as possible, then you'll use a trigger shot. There's different types of trigger shots, but in general, the trigger shot resumes meiosis, it finalizes maturity of the eggs, and it allows us to go and retrieve them approximately 35 to 36 hours later. You'll find that your clinic is crazy about making sure you take your trigger at the exact time and you know exactly when your retrieval is, because timing is very important. We don't want you to ovulate through. So if you overslept and didn't show up for your egg retrieval, you would actually ovulate all of those eggs, and that would, 1, not be great, 2, probably be painful, 3, make the whole process worthless, and 4, if you'd had recent sex, you could get pregnant with high order multiples. So side note, do not be having intercourse throughout this process. Now, the egg retrieval is the most invasive part of the process. It is IV anesthesia, so it is a low dose sedation, but you don't have a breathing tube in, you don't remember any of the process. So with the vaginal ultrasound, we have a rather large needle, and then with that, we are able to enter into your ovaries and drain out your follicles and get test tubes full of your eggs. That's literally how the process goes. When we do that, the eggs will then be looked at under the microscope. The outer cells, which are called the cumulus, are all stripped away so that we can tell which eggs are mature or not, and then the eggs are frozen. Importantly, eggs don't get freezer burn. I get asked that all the time, like, are they going to be worse if I wait to use them for 10 years versus if I use them in a year? The answer is no. They are not going to degrade over time. And so that's it. For you as the patient, that's all you go through, and then you're done. But that's not really all that there is to the story. One of the top questions I get asked is, how many eggs do I need? And that's a really, really, really good question. In order to fully explain it, I have to let you know what's going to happen to the eggs when you go to use them. Helping you understand that will help the whole process make sense. First of all, you're going to get more eggs the higher your AMH or your antral follicle count. So when you're younger, you have more eggs than when you're older. Eggs are constantly leaving that vault over time. Thus, you have a larger group of eggs available every month. As you get closer to menopause, fewer eggs are released from that vault every month. Also, as you're younger, you have better quality eggs. Quality means genetic stability. So let's think about that one really quickly. Your eggs, when they're inside of you, in your vault, waiting to come out, are frozen in a stage of meiosis called metaphase. Metaphase is when your chromosomes meet up in the middle and they're held apart by these meiotic spindles. When you use that trigger shot with your egg retrieval, or whenever you ovulate, your eggs undergo resumption of meiosis and they finalize that last stage. That means these chromosomes pull apart, allowing an egg that can later be fertilized. These spindles break down over time. So the longer the eggs have been sitting in the vault, meaning the older that you are, the more degradation that has occurred, and the increased probability that your eggs are going to split abnormally. These abnormalities are called aneuploidies, they're chromosome abnormalities, and they are more common with age. So if you've ever heard that over 35 is advanced maternal age or geriatric pregnancy, again, I hate it, then you know this is why. That is because after the age of 35, the prevalence of having a chromosome abnormality in one of your eggs is the same or greater than having one that's normal. So you're gonna have more success with egg freezing the younger you are and the more eggs that you have. Again, it doesn't mean it's not worth doing later, but you have to put it all into perspective. So let me explain the process to you. Let's pretend that you are 30 and you go through the process and you have about 20 eggs. So I get 20 eggs at retrieval, yay, we're all happy. You go on with your life, you come back to me 5 years later and you say, now what? Now what? Okay, well now you wanna know, first of all, you wanna know if you should use your eggs or not. Should you use them? You froze them, you paid for them. You've been paying an annual storage fee for them every year. Should you use them? I say this is a great time to have a what are your goals conversation with your doctor. Because if you want just one kid and you have a batch of 20 eggs, you may just want to use them. If you want 5 kids and you have a batch of 10 eggs, it may make more sense for you to get pregnant right now and use your eggs in the future for future children. Or you may want to undergo an evaluation, and this is what I recommend. So when you find a future partner or you're ready to do this, you come to me and we do an evaluation of your ovarian reserve, see if your fallopian tubes are open, and check sperm of your partner if you have a male partner. From there, we can then make a determination of what is your goal and what is the best plan. Maybe it includes using your eggs right now. Maybe it is not using them, but letting them stand. Maybe you need to go get more eggs. Who knows? It's personalized to you and your goals. But let's say we're going to use your eggs. So now I'm going to thaw them. This is so important to understand. Not every egg is going to survive the thaw. It's not going to. An egg is a single cell. It is a single cell full of water and it's very fragile. Eggs are so fragile, in fact, this is why egg freezing was experimental until this decade. So if you were me and back when I was 30, this was not a thing that was done. And that is because most eggs did not survive the freeze thaw. Now that technology has advanced, the majority of eggs survive the freeze thaw. National average is around 80 to 90% of eggs will survive the freeze thaw. So you have to account for that number when deciding how many eggs that you need. I will stop right here and say this. Some single women are told that they need to purchase donor sperm to fertilize the eggs at this time because embryos have a higher survival rate than eggs. Okay, that's not a false statement. Embryos have a higher survival rate than eggs. Embryos survive the freeze thaw about 98 to 99% of the time. So that is significantly higher than 80 to 90%. But the question is that 9% difference worth it to you? I don't know. It might depend on your situation. If you are going to need donor sperm anyway, then maybe you should just buy it and go ahead and fertilize them. Or if you have very few eggs, if you have a really low ovarian reserve, maybe it would make sense for you to fertilize them. It depends on your goal. If your goal with egg freezing is to save your eggs for a future yet unidentified partner who may have their own views, and I don't care what sex or gender they are, they may want to have a say-so in the donor, they may want to have their own child. Does it do you any good to have eggs that are fertilized with donor sperm, or are those going to be embryos that you've now created that you're not going to use? And if they're out of line with your goals, you should definitely not fertilize with donor sperm, no matter your situation, because the whole point is to keep more doors open for you. And if fertilizing them with donor sperm is not what's in line with your goals, you are actually shutting a lot of doors. You are leaving one pathway towards parenthood in the future, and that is committed to this particular donor. So I just want to say what's right for one person isn't right for everybody, and I get that. But you should have an open and honest conversation with your fertility doctor about what your goals are before you make life-altering decisions like committing all your eggs to a sperm donor if that's not who you're really looking to have children with. Okay, so back to now we have your eggs. We've got 20 eggs and we're gonna go thaw them all. Not all of them are gonna survive. In my lab, it's about 90%. So now I'm gonna tell you I have 18 eggs that have survived the freeze thaw. They're gonna then be fertilized with sperm. So one sperm, wherever they come from, is gonna be picked up and each egg is gonna be cracked open and the sperm injected inside. That type of fertilization is called ICSI, ICSI, and ICSI is utilized to fertilize the eggs after they've been frozen. It's the only option. When you do that, you're gonna have a fertilization rate around 80%, so it's not gonna be 100. So let's say now your 18 eggs have now gone and you have 14 embryos fertilized. Not a bad number. However, they have to grow it in culture until when the embryo would normally implant in your body. that's when we like to do an embryo transfer. That's when we have the highest chance of success when an embryo is called a blastocyst. A blastocyst is approximately 100 to 200 cells. Think of it like a little hollow soccer ball. So all the cells you see on the outside, that's the placenta, and then inside is a little cell mass that actually is going to become the baby. This is a very sturdy stage. That's where we freeze embryos, that's when we biopsy embryos for genetics, and that's when we transfer embryos. About half of your embryos will make it to that stage. So now you have 7. If we are to then go and do genetic testing on these 7, the results of how many are normal is going to highly depend on your age right now. So let's say you're 30, that number should be about 60 to 70% normal. So I'm going to say, okay, of the 7, I've got 4 that are normal. And each normal embryo has around a 70% chance of becoming a baby when you do single embryo transfers. So 4 embryos, we would feel comfortable saying 2 kids. Okay, if you wanted 2 kids and you had 20 eggs frozen and you're age 30, that seems pretty good. Now remember, we're making assumptions. We're using odds and averages of population base as a whole, and I'm applying them to you right now. But you may perform better or worse at any of these metrics, and we don't know that. We're just trying to use these to guide our expectations. So the younger you are and the better quality, you actually need fewer eggs per baby than if you're older and you have poorer quality. That's really important to keep in mind as you're trying to gauge what you should do in this moment. I also like to say that numbers give perspective, but they are not everything. Please, please, please remember that any eggs at your current age is more eggs at a younger age than you ever will have in the future if you're waiting. So if you're 36 and you have low ovarian reserve and you only get 6 eggs, hey, that's 6 eggs at age 36. That surely is better than waiting till you're age 40. There's no doubt of that. Now, is that a guarantee of getting you a child? It's not. But do you have an opportunity there that you wouldn't have had if you hadn't frozen your eggs? Certainly. Do you increase your chance significantly if you can do another round and get another group of 6 eggs and now you have 12? You do. And this is sometimes why we recommend multiple cycles. It's all based on you, your goals, and how many we get, how old you are. So if you come to me and you want maybe 1 kid you don't know, you want 5 kids, or you want the Brady Bunch, we have to make a different plan for you based on your goals. You're gonna have a different plan than your best friend, and that is totally okay. You need to find a fertility clinic that you trust, a doctor that you like, a doctor who asks what your goals are, somebody who's going to help explain this process to you, going to give you real-time information so that you can make the decisions that are best for you. I also always get asked, well, what's the best age to freeze your eggs? And it really does depend. Studies have shown that around age 32, you're still gonna have peak egg quality and egg number before it starts to decline. So that's kind of a, if you think you want to do this, you should consider it. That being said, I freeze eggs for women in their upper 20s or their early 30s all the time, and that's because they know this is a goal for theirs, yet they know they're on a different path. They're not ready to get married, or they're going to medical school, want to be a neurosurgeon, or whatever it is. They know they're purposefully delaying. So here is my thing to you. If you know you want to be a mom, or you know you want to have a family, yet you are waiting on purpose, I support that. I waited. You should have the information you need. So don't just blindly wait and ignore your fertility until it's too late. I mean, when on earth does that work for any goal? Oh, I want to be a doctor, so I'm just going to ignore it until see if I get into medical school. It doesn't work that way. So if this is important to you, make it important. I know there's so much stigma and faux pas around talking about your fertility and talking about infertility and egg freezing and miscarriage. And the more we talk about it, the more we break it down. So let's break it down. What you need to do is, if this is a goal for you, then you should get an evaluation. If you're in your late 20s and you know you're going to delay having children, you should come and see me, and we can get an AMH and an antral follicle count, and we can talk about egg freezing, and you can understand if it's good for you. And especially this, if this is a goal of yours and getting information would change. If I told you at age 26, you need to freeze your eggs now or you're going to be out of them by age 30, would you do it? If the answer is yes, then why don't you have that data at age 26? If getting data would change your information, you deserve to get that information. I speak for myself in all fertility clinics. We do fertility assessments all the time. Ultrasound, AMH, a consultation, talk about your goals, talk about the process. Try to understand if this is right for you. You're always gonna have more success. More eggs you have, the younger you are. But that doesn't mean it's not worth doing at an older age or with fewer eggs. It just means you may have a different journey than somebody else. And that is okay too. Also, I would love it if you would subscribe to the channel. I can't tell you how much it helps when people subscribe to your channel. Helps spread your message, and if you care about educating your women's health, help me out. As always, there's more information on the As a Woman podcast. I have tons of episodes there. Feel free to check them out, and I'm on Instagram at Natalie Crawford MD. Thank you guys so much.